So welcome to our August Lunch and Learn. Thank you all for being here. We're again doing kind of open mic style and just having folks from various agencies sharing about their programs. We have a few folks scheduled to share, and then anyone else we'll just open it up at the end. Michelle, do you want to kick it off?
For real this time.
For real this time. Yep.
I just came into the office and I literally hit the ground running.
Awesome.
Okay, so open enrollment starts the 15th of October. We expect that a lot of the incoming seniors, people that are turning 65 now, are a lot more tech savvy. They're probably going to be doing a lot of things on their own and doing their own research if they're wanting supplemental or whatever. They still, of course, will call us if they have any questions or need any further guidance. What we're going to do this year, since we can't hold any in-person welcome to Medicare sessions that we've done in the past. We've usually held those at the library or at St. Peter's. We are going to do a recorded Zoom presentation with Barb and Sandra. Barb's just leaving. She was in the office for a minute. And it'll have the PowerPoint and everything. And then we'll put up the information, phone numbers that people can call. My phone number, because we hand out that PowerPoint at the in-person presentation. So I expect to mail out a lot of those to folks, which, is not a problem at all. So that's how we're going to handle that this year. We were going to do one live, but I really want to do the closed captioning. At least I think that's a good idea. But I really don't want to have to try to type as they're talking. So I will just let people know that it's recorded, and here's the phone numbers if after the presentation, take notes, whatever questions you might have, and then give us a call. So that's the way we're going to handle that right now. And I'm certainly open to suggestions or anything. If anybody has any knowledge of a Welcome to Medicare, has been to one, or has questions about a Welcome to Medicare, you can certainly email me. It'll be out on the Rocky website.
Thanks so much, Michelle. Would you give us a little overview of Area 4 in general?
Yeah. So we're a resource center. Sandra Lowry and Barb Gilski are our SHIP INA resource specialists. So they are working remotely right now. They handle everything Medicare and everything that kind of ties to it. Barb has a background in Medicaid, so she's very helpful to us because people get those two things confused all the time, and they also go hand in hand with a lot of our clients. So Sandra has been doing this job for 20 years, so she is very fluent in Medicare. It's a very overwhelming time for us coming up in October. They're going to have to handle everything over the phone and by Zoom. Area 4 has invested in 25 iPads that we will loan out to folks. It's already got Zoom on there and an email account set up for it. So say Sandra or Barb really needed to connect face-to-face with a client. Sometimes it's really better for someone who's hard of hearing to be able to see you. And all these people, they're used to visiting with Sandra for quite a while too. So we would be able to loan those out. We also will loan those out to people who may want to participate in some of the other programs that we have going on, which again are on our website. There's one called Well Connected. And then Maria Murphy, our volunteer coordinator, has found a couple of other really great websites. One I think is called Senior Planet. Lots of great virtual adventures on there. And so if somebody saw that on our website, wanted to participate in it, but does not have a computer, we would loan them out one of our iPads. We've kind of gone through them and set up what they need. They're very simple to use. and we can do a no contact delivery to that person. And then, you know, they could always call if they needed, if they got stuck on something or needed any help. I am in the office. I am the only one in my program in the office right now. And I am handling a lot of administrative stuff. So Barb and Sandra a lot of times want to mail specific applications or literature information to their clients. And so they just shoot me an email of who needs what. And then I mail those things out, and I stuff the envelope with a bunch of doodads too, because right before all this happened, we spent tons of money on our doodads for the year for all of our outreach, and you know, we usually do health fairs and all that kind of stuff. And so I've got boxes and boxes of fun stuff to give away. Maria and I have also been working on things specifically for caregivers. Julie, maybe you might have an idea or somebody I could contact at Pureview to see if this is okay. We were thinking of doing like putting a little sample bag together of the items that we have, and then having it at the doctor's office. And if people expressed interest in it, or if a caregiver brought a patient in and they could say, hey, look at these things that Area 4 has for you, then they would contact me and I would mail them those little items. Just some of the simplest things that we found that might make a caregiver's day a little bit easier. We also have a really nice book that we ordered. Hang on one second. I think it's called The Comfort of Home. This is one specifically for Alzheimer's, but we have one just for caregivers that we will mail out free to folks. Good Lord, what else we have going on? We're redoing our website, the Area 4 part of the website, to make it a little more exciting. We're trying to find a lot of educational and entertainment opportunities to put out on the website for folks to engage in. Maria's got a league of volunteers that are making phone calls to seniors just for somebody to chat with. Just simple phone conversation, telling stories. And then also, if the volunteer kind of gleans from the conversation that senior might be feeling a little stuck at home, needs some help getting groceries or some other assistance in any way, then they pass them over to me, and I connect with them to get them what they need, whether it's a LEAP application or somebody deliver groceries or whatever. So really busy.
Michelle, I have a question. This is Liz. I'm a naturopathic doctor, and I was a caregiver for my elderly father, and I think it's awesome that you have that resource. And I have a patient right now. I'm trying to help her with a neuropsych eval for her mom and getting her mom with a geriatric caregiver. So I would love a couple of those books and some of those bags if you're willing to give them to me.
Yeah.
And then also I have a patient who just fell and broke her hip.
Oh.
And she's 81 and she's in a home by herself. I've been told she won't be able to get anybody in there to help her for 2 weeks. So if anybody knows of a resource that I could get somebody in there to her home to help her with groceries or anything before 2 weeks, that would be awesome.
Okay, where is she located?
Here in Helena.
Okay. As far as getting a caregiver in or somebody just to stop by, or you need something like 24/7, just to stop by.
Yeah, just somebody to stop. I know her daughter's been in town, but her daughter might be leaving soon. So I talked to her on the phone yesterday, and she said that Dr. Bailey's office was trying to get somebody in her home to help her, but it would be 2 weeks, and she doesn't have anybody here.
Yeah.
So,
resources along those lines are stretched pretty thin, and
are they?
Yeah, but let me give you Sandra's phone number, Sandra Lowry.
Okay.
It's 457-7368.
Okay.
She might not have any quick fixes for you.
Okay.
But if there's something we can do to get some grocery delivery.
That's what I was thinking.
Yep, I can help you out with that. So we can maybe connect by email, or you can call me later. My number is 441
Mm-hmm.
3985.
Okay, great.
And if I'm not in my office, I get my messages on my email, which is
Okay.
connected to my personal phone.
Okay, yeah, because I was just a little worried about her because
Yeah, we could at least get some groceries delivered. We have a couple, so I'll tell all of you this as well. We have a couple different ways to go about some grocery delivery for seniors that don't want to go out and go to the store. Van's Thriftway is working with us. They do a delivery service, but it's a $10 charge. And that's a stretch for some of our clients on top of their grocery bill. So what we've done is Maria's got some volunteers, and we have this app called Helper. And so if a client needs someone to, if they aren't able to get online at all, and they need someone to shop for them, they can shop through Vans, and one of our volunteers will go shop and then deliver the groceries. Now, there's different ways that payment works for that. If the client can pay by a credit or debit card, they have to call Vans on the day that the volunteer is going to shop. They give Vans accounting department their information. Vans only keeps it for that day until the volunteer goes through checkout, and then they don't keep that information anymore. They don't want to be responsible for it. So if someone is using that service repeatedly, they're going to have to call and give their information each time. If they'd like to pay by check, then they'll work with the volunteer for a convenient time for the volunteer to come to their place of residence, pick up the check, go shop, and then deliver. And I talk to the clients when I'm, because I'll help them do their grocery list, because it has to kind of transform from one format to another and then go out on the helper site. And so I let them know all the details and how they can safely put that check somewhere where the volunteer can pick it up and it's no contact and all that. My other new favorite way of doing things, Safeway also will do that kind of same scenario, and then the volunteer can just go do curbside pickup, and the Safeway folks are doing the shopping. My other favorite way of doing things, simply because people are getting the most for their dollar, is if they can get online and shop at Walmart and do the pickup and delivery or pickup. And that way they're seeing what's in their cart. They know exactly how much everything is. They can allow for substitutions. Have any of you used that? It's like my new favorite thing. I have not set foot in Walmart since February. I'm never going back. Squeaky carts and screaming kids, I don't have to deal with it anymore. If they can get online and do their shopping on their own, that's awesome. And then we'll just work with a volunteer to do the pickup and delivery. Even if they can't get online, if they connect with me, I set up because all you need is an email and a password. I set up a pseudo area 4 Walmart account, so I could actually do it for them. They can just be on the phone with me, tell me what they need, and I'll do the shopping online while I've got them on the phone. So if they're specific about a brand or a size of something, then we're all good with that. So we've just really tried, because that's to me, that's one of the biggest things is, you know, if a senior, even if they're able, can drive themselves, they might not want to go to a store, and I don't blame them. Like I said, I'm not really doing it right now either. So
Michelle, you can do that at Super One too.
Super One does it too.
And
Oh yeah, that's right.
And you can do it at Real Foods. They'll shop for you, and you give them your card, and then you just pick it up
over the phone.
Mm-hmm.
Okay.
And you can do an email too. I think you can send an email to Real Foods.
Oh, really?
Mm-hmm.
That's cool.
And they take food stamps or whatever it is. I can't remember the other name for it, but anyway.
That's cool. Okay, yeah, we're just trying to find any and all alternatives for folks to get good, healthy food, and not have to make themselves uncomfortable doing it. So, and feel free to, if you guys come across anybody that is looking for that service in any way, just give them my phone number and we'll get them taken care of as soon as we can.
Thanks, Michelle.
Well, yeah, I can't. It's all just swirling around, right? But yeah, thanks for letting me give an update.
Yeah, thanks so much. Area 4 agency and agenting is also on Connect, and that'll go right to Michelle. So for clients where a Connect referral is going to work for them, because they're okay with that information transmitted that way, also a great option.
Yes, definitely.
I want to turn it over to Angie Murphy. I think that'll be a nice transition.
Hi, thank you. I am Angie and I am with St. Pete's Community Paramedics. I'll just give you a real quick brief what we do, and then if you guys have any questions, please feel free to ask. So we are actually a pilot program, but we are currently transitioning from pilot into just a program. And a little bit about, I guess, what we do. So I guess what we are is we're kind of a mix of a home health agency that is staffed by paramedics and EMTs who've had additional education in a little bit of home health. And what we do is we serve and we go into the homes or the not homes for the homeless population of underserved populations, people who maybe don't qualify for home health. We do a lot of assistance with palliative care, and we just go in and we do anything from maybe a post-discharge follow-up on a patient to wound care to welfare checks, home safety assessments. We do some oh boy, let me see, patient education, lab draws, medication management and setup. We do just about anything that's needed by our patients out there. And we kind of got kickstarted real quick, like to help the population who doesn't want to go out and get their groceries per se, or who cannot go into the facilities because they have a for whatever reason, they can't be exposed to whatever diseases or whatever is out there currently. So we do it for them. We go into the homes and take care of them that way. So when you're asking about home health or PAL care being able to go in and help these patients, that's kind of what we are, is we're just an offshoot of these programs that we're just an extra, I guess, an extra branch of the team. So that's kind of what we do. We work through the primary care providers, and we're kind of their eyes and ears. We also do TIDO facilitations. We've got equipment to go into the homes and help do that platform with the physicians and their appointments. So that's where we're at. Does anybody have any questions?
I don't have any questions, but I think it's a cool idea. So
Well,
thanks for sharing. I had no idea that it existed, so that's awesome.
Thank you. We're just about maybe not quite 6 months old, so.
Angie, does someone need to have insurance for that? How does the payment for your services work?
Currently, because of the pilot, we are actually not charging for our services, so that may change. The charges that they see are if it is a procedure-based, lab draws and stuff like that, they'll get charged through the hospital for those. But no, at this time, they do not have to have insurance, which is kind of how our program is designed to work, is to help with those patients who are underserved, the ones who don't qualify for those other programs. That may change. It may change in the near future or the far future, and hopefully we'll be able to tell the patients long before that is an issue.
Thanks so much. I'm glad we were able to get you in. Other questions for Angie?
Angie, I was just going to ask how people contact you, or how do they get into the program?
You bet. So we do have the Connect, obviously. Then we have two other forms of contact. You can call us. We have a cell phone as our contact because we are mobile, and that phone number is 594-8632. And then you can also email us at communityparamedicine@sphealth.org. And either one of those are just as easy to get a hold of us. Somebody will respond.
Thanks.
Great. Thank you, Angie.
Thank you, Julie.
Next up for in-home care of a very different kind, Mary Pierce, I believe, is talking about nurse-family partnership.
Hi, everybody. Again, I'm Mary Pierce. I'm the home visiting supervisor at Lewis and Clark Public Health. So in our home visiting services, we have 7 different types, but today I'm going to be talking specifically about the nurse-family partnership. So we have 2 full-time nurses on staff for women who are pregnant before 28 weeks gestation. Then they can go in and work with that new mom before she has her baby to try to help her get ready for baby, to monitor her health, to collaborate with her doctor. And then once the baby is born, can help work on bonding, breastfeeding, play, and engaging your child, and the whole family well-being. So there is one other way to be able to get into the program. It's called the MulTip program, which is just basically means if a mom has had other live births, then she can get into the program at any time during her pregnancy. So for first-time moms, it has to be before 28 weeks gestation. And for not first-time moms, then it's any time during their pregnancy. So, and we're always looking for new referrals, and you can refer to us through the Connect system. It's under the partnership for home visiting. So if you're in Connect, you're going to be looking at Lewis and Clark, the partnership for home visiting. Or if you're in there and you're doing a search, you can just do under Lewis and Clark, you can do just type in the partnership and it's in there. So we have a few other types of home visiting programs, but the nurse family partnership is the only one that will have a registered nurse that comes out and works with the family. So we like to keep them utilized as much as possible. Can I answer any questions for anybody?
I have a question, Mary.
Sure.
Is it, because I have a patient who's newly pregnant, and she had a miscarriage recently, and now she's pregnant again, and she's from Turkey, and she married a man from the United States, and she doesn't really understand how the system works here. I don't know if she would qualify for a nurse to work with her. She does have a little bit of anxiety because of that recent miscarriage. And she's not, this is her first pregnancy.
Okay. Do you know how far along she is in the pregnancy?
She's 6 weeks. Well, she was going to get an early ultrasound last Friday. I haven't talked to her this week. But she's, I think, 6 or 7 weeks.
Yeah, she would be a great candidate. So you can refer her to us through Connect.
Okay.
And then one of the nurses, either Ray Brown or Marissa Johnson, will be able to go in. Well, they're not going into the home at all right now, but they do virtual visits.
Okay.
And certainly can help her. They do it about once a week, so there's a lot of contact there. and
Okay, that
help
would be
them
good for
through
her.
any anxiety.
That would be great.
Now, they
Thanks.
do
But I
have
don't,
to have an income requirement. They have to be eligible for WIC.
okay, I don't know if she is,
Do
but
you know if
I'll
she's
have,
eligible for WIC?
I don't,
If
but
if not, if you don't know or if you don't find out, we can still put her into the Parents as Teachers program, which is a fantastic program in itself. It's not a nurse that comes out, it's a social worker or an educator that works with the family.
okay.
But they
think
work very
that-
closely with the nurses, so they would certainly kind of have that all together.
Okay, thank you. I will make sure that I refer her and see if she qualifies for WIC.
Great. Sure. Yeah, great. Thank you.
Mm-hmm.
Awesome. So Liz, both of those are going to be under the partnership.
Any other questions?
Liz, both NFP and Parents and Teachers will be under partnership. And I'm happy to walk you through the setting that referral since partnership has some other questions in Connect. And I'm just happy to walk you through it. So I'll follow up with you.
Hi, Mary. This is Tabitha with Military One Source. Do you guys have a process in place where you're identifying families that are connected with the Guard, reservists, military?
Yes, actually, that's one of the questions in the referral process, is if they have any military service, because that is an automatic qualifier for our Parents as Teachers program. So yes, we do ask that.
Okay, yeah, because for those that are, have a partner who's is currently in the National Guard or Reserves or has a partner in there, they have full access to the resources through Military One Source as well. So we have parenting coaches available for those in that 0 to 5 range. So it would be a nice, I think, sequential follow-up from your program of the home health to then continuing them with parenting coaches up until the kiddos 5.
Yeah, sure. Yeah, the nurse, I should state that the nurse family partnership goes from prenatal to age 2. And then sometimes families will transition into our Parents as Teachers program, which goes prenatally to age 5. So we kind of overlap too. So
Thank you.
Great. Thank you. Okay, I'll turn it back over to you, Julie.
All right, thanks, Mary. Any other questions from the group for any of these programs, or anyone else want to share what your program's been up to?
I'll say a few things about Head Start.
Awesome.
Head Start right now is got some classrooms going for children to be actually physically present in the classroom, and they're going to start September 14th unless things really change with COVID. And we are also providing remote learning opportunity for the children that are not going to be in our brick and mortar classrooms. And we are really encouraging people to register for remote learning. We still have some slots open. It's for children who are 3 by September 10th of this year. There is an income eligibility requirement for the program. The remote learning program will offer a vision screening, a hearing screen, a dial assessment, which is like a speech language assessment. We'll be providing packets, projects for the kids to do at home with their parents. There's a monthly school to home project, which will come home. That's a free book and a free activity. And we have a designated Head Start teacher who's solely going to be working with the families who have children in the remote learning. So there'll be, stuff online. I'm not sure if it will be a Zoom class. It's still kind of being tweaked, how it's going to look, but there'll be a lot of flexibility for parents to use these resources. It's not like it's going to be scheduled that you have to be in class, you know, every day from 10 to 1 or something like that. It won't be that strict a schedule, but we do have family advocates who will be supporting the families remotely in the program and helping them if they need to get information about resources and that. So we do have some openings, and encourage people if they have children 3 to 4 to consider applying. Our income eligibility is 100% of poverty or below, and we're allowed to take some families between 101 to 130% of poverty. And if you have any questions, just call us at 457-7308. Thanks.
Thanks so much, Lizzie. While I have you all, what are there agencies in town that you want to hear from next Lunch and Learn, who I might reach out to and try to gather them up? Put you on the spot. Let me know if there are.
I would like information about the mental health resources, especially now with COVID. You know, if there's anything, I guess I'm thinking if I'm supporting a family and they are struggling with anxiety or depression, if there's any sort of COVID specific resources, or and then the regular general resources.
And Julie, I was just going to ask a similar COVID related question, kind of what adult basic education is doing now with COVID too, how they're operating.
At Helena College. I'll see if I can get a hold of them. Haven't wanted to bother them as the school year starting, but I'll reach out. I know United Way they did a lot of kind of COVID updates over the summer. I think many of you were on those calls. So if you saw their kind of general COVID resource list earlier in the spring and summer, it's pretty much the same. They have an updated version on their website. The only real change on COVID resources in Helena has been just taking out the kid packs since school's starting. And also just FYI, Food Share looks like they're on pause with the farmers' food boxes for a couple of weeks, and we don't know yet what's happening next after that. And I'll see what other COVID stuff we can round up for. We'll do 4th Friday of September. Thank you all so much for being here. Feel free to stay on for any other questions or networking, and happy Friday, everyone.
Happy Friday. Nice to see you.